Mainers will soon head to the polls for the presidential primaries next week.
Super Tuesday, as we call it, is just the first election day of the year in our state. And whether it is voting for candidates or ballot measures, those results can impact many aspects of our daily life, including health care. News Center Maine's Sam Rogers joining us live in studio with more. Hi, Sam.
Hey, Brian and Amanda. Well, the American College of Physicians recently released a study looking into how individual voters can shape healthcare policy, sharing the message: if there is more voter participation, there will be better healthcare policies and, in turn, better healthcare. Here in Maine, healthcare professionals are encouraging their patients to speak out about what's important to them.
I just sent an email to my legislator this morning about banning flavored tobacco, LD 1215.
Dr. Patrick Connolly practices family medicine at Martins Point Healthcare in Portland.
Good health in our society is dependent upon things that are done at a public level.
So Dr. Connolly suggests people talk to their representatives.
Whether it's adequate nutrition, whether it's adequate housing.
Or share concerns with their physician, who can speak on their behalf during public testimony on healthcare legislation in Augusta.
Be able to explain it to our representatives and senators is a real privilege.
During this legislative session, a focus for Dr. Connolly and many Mainers is gun legislation.
Gun safety is a public health issue. The biggest risk is actually to individuals themselves, risk for suicide or self-harm or domestic violence.
Maine Health's Chief of Government Affairs, Katie Fulham Harris, in Augusta Wednesday advocating for more financial support for hospitals, among other topics. She says it's important for Mainers, healthcare workers or not, to stay informed in policy decisions.
Because it impacts them directly through the healthcare that they receive. It impacts them through access, quality, and the cost of healthcare that's provided.
The American College of Physicians study found states with fewer barriers to voting have better health outcomes. Maine was ranked 15th for ease to voting access and had the highest voter turnout percentage in the nation in 2022. The ACP also encourages all healthcare professionals to vote.
So we do voter education, we do voter registration efforts, and we provide opportunities for our care team members to understand the policies that we're working on and why.
For my colleagues, I make it a priority.
Dr. Connolly says voting can lead to positive change if you take part.
You can kind of sit back and say, oh, this is terrible what they're doing to me. You have a chance to actually do something about it by voting, for the people who are going to best represent you.
I also just spoke with Dr. Omar Alik, the president of the American College of Physicians. He says this study was a priority for the organization so professionals and patients can express what healthcare policy changes they'd like to see. Then the ACP could make policy recommendations. Dr. Alik adds doctors and nurses see patients of all walks of life and know how certain policies can impact a specific group of people. Brian and Amanda, having more patients and more healthcare workers speaking to their lawmakers about policy, Alik suggests provides a new opportunity to make real and effective change.
Sam Rogers live in our studio tonight. Sam, thank you.